to examine for these points, you need to actually press fairly deep. And in somebody who has a relatively small buttock, you can use your thumb or your fingers and dig in. You see how deep I'm going to really get down to the piriformis. And with somebody with a really big muscular or plump bum, sometimes to get down there, especially if you've got a small therapist, you may actually even need to use your elbow. So I can go down, I press, and now we're going to do ischemic pressure, and I focus down, press until, and the muscle runs in this direction, so my movement is that way, seeking for the feeling of tight bands, which may be quite difficult in such a deep muscle, but I'm going to be watching his face and I'm going to be listening. He's going to give me feedback as to whether it's sore. Once I'm down there and I focus in, there's a little deep swelling. You can use one finger on top of the other to get down that far. Use your thumb, support your thumb. It's this kind of pressure that can injure people who do a lot of manual therapy. So this you need to be really careful while you're doing this, especially when you're down there and now you have to apply ischemic pressure, put enough pressure to cause the pain, then reduce and gradually increasing pressure. It's that injures hands. So be aware that this kind of treating this kind of deep muscle is potentially problematic for you as a therapist, and therefore it's not a bad thing to go to something which is much more robust. And as long as you're fairly gentle with the use of your elbow, you can get in and you just ask and you watch and you say, how does that feel? And once you find it, you can vary the pressure of your elbow perfectly well to treat deep buttock triggers.